Hold your hand flat in front of you right now and look closely at your fingernails. Not the polish, not the shape, but the actual nail bed underneath. In the next few minutes, I am going to show you 4 specific things to look for on your nails that medical research has connected to some of the most serious and silent health threats facing adults over the age of 60. And the last one on this list is the one that genuinely stops people in their tracks, because it is something most of us look at every single day without ever realizing what it means. I am Dr. Lena, a neurologist with over 2 decades of experience working with patients in the over 60 population. And I want to be honest with you about something right from the start. Your nails are not just cosmetic. They are biological structures fed directly by your bloodstream, and the tiny capillaries running beneath each nail bed make your fingertips one of the most sensitive and readable indicators of what is happening inside your cardiovascular and neurological systems. The challenge is that most routine medical appointments simply do not have enough time to cover nail examination unless something looks dramatically wrong. So the information exists in clinical literature, but it rarely travels from the exam room to the people who could actually use it. That is exactly what I want to change today. Before we go further, drop your age in the comments and let me know whether anyone in your immediate family has ever experienced a heart attack or stroke, because your family history is one of the strongest predictors of your own risk. Now let me give you a little biological context. Your nails grow from a zone of specialized cells called the nail matrix, tucked just beneath the base of each nail near the cuticle. Those cells need a constant and reliable supply of oxygenated blood to keep working around the clock. The network of vessels supplying your nail beds includes some of the smallest capillaries in your entire body, and that is precisely why your nails become such a valuable window into your vascular health. The smaller a blood vessel is, the less buffer it has when circulation starts to falter. After 60, the early warning system your body built into your fingertips becomes more relevant than it has ever been. The first sign is a change in nail bed color, specifically a bluish or purplish tint visible through the nail near the base. In medicine, this is called cyanosis, and there is a distinction most people are never taught that completely changes how quickly you need to respond. Peripheral cyanosis is when the bluish color appears only in the nail beds, while your lips, tongue, and mouth remain a normal pink. It develops gradually over weeks or months and reflects a problem with how well oxygenated blood is reaching the extremities. It is a warning, but not an emergency. Central cyanosis is when that bluish color appears not only on the nails, but also on the lips, tongue, and inside the mouth. If you ever see this pattern, that is a medical emergency. It means the blood circulating through your body is not carrying adequate oxygen at a systemic level, and you need help immediately, not a scheduled appointment. Persistent peripheral nail bed cyanosis has been associated in research with early-stage heart failure, heart valve abnormalities, and chronic respiratory conditions that place strain on the heart. Heart failure is one of the most commonly underdiagnosed conditions in the over 60 population, precisely because its early stages produce no dramatic symptoms, just a slow and quiet reduction in how efficiently the heart does its job. Your action step. Take your hands to a window in natural daylight and look at the nail bed near the base of each finger. If you see a consistent bluish or purplish cast that does not fade when your hands warm up, document it and bring it to your physician. Ask whether an echocardiogram is appropriate, and if you ever see that coloring on your lips or tongue, do not wait. The second sign is nails that have become noticeably more brittle or slow-growing over the past year or two. Nails that split lengthwise, peel in thin layers, break easily, or barely seem to grow from one month to the next. What this reflects biologically is that the nail matrix is not receiving the consistent supply of nutrient-rich blood it needs. One of the most common vascular explanations for this in older adults is peripheral artery disease, or PAD, which occurs when arteries narrow due to atherosclerotic plaque buildup. Here is what surprises most people. The plaque narrowing the arteries to your fingertips is the exact same type that causes heart attacks in the coronary arteries and strokes in the cerebral arteries. Plaque formation is not localized. When it is occurring in your peripheral arteries, it is almost certainly occurring elsewhere simultaneously. PAD tends to announce itself through a recognizable cluster: brittle, slow-growing nails, hands and feet that feel consistently cool even in a warm room, and a heavy, cramping ache in the legs during walking that reliably goes away with rest. That third symptom is called claudication, and it is among the most consistent signs of meaningful arterial narrowing. Your action step. If your nails have become more fragile and you experience leg heaviness during walking that improves with rest, bring both observations to your doctor together and ask specifically about an ankle brachial index test. It is painless and can catch PAD at a stage where treatment makes a real difference. The third sign is one you can check on yourself right now, in about 5 seconds. It is called the capillary refill assessment. Raise one hand to roughly heart level. Press your thumb firmly down on the nail of your index finger for 2 full seconds, and watch the nail bed turn pale as the blood is temporarily pushed out. Now release and count slowly. How quickly does the pink color return? In a person with healthy circulation, it returns within 2 seconds. If it consistently takes 3 seconds or longer across multiple fingers, that is a meaningful signal that your microvascular circulation is not functioning at full capacity. Make sure your hands are warm and you are in a warm room before drawing any conclusions. And note that certain blood pressure medications can slow refill modestly on their own. A second useful check. Press the back of your hand against your cheek. Your face stays close to core body temperature. If your hand feels consistently and noticeably cooler, even after time indoors, that is an additional indicator worth noting. Research in adults over 60 has associated delayed capillary refill with reduced cardiac output, elevated stroke risk, and undiagnosed atrial fibrillation, an irregular heart rhythm that is among the leading preventable causes of stroke in older adults and frequently goes undetected for months or years. Your action step. Do this test right now on at least 3 fingers on each hand in a warm room. If the refill is consistently at or beyond 3 seconds, write that down with today's date and bring it to your next medical visit. Ask whether an electrocardiogram and cardiovascular evaluation are appropriate. And tell me in the comments how many seconds yours took. Now we arrive at the fourth and final sign, the one I saved for last because it is the least well known and the one that consistently surprises people the most. Look at the very base of any fingernail, just above where the cuticle meets the nail. Do you see a small, pale, crescent-shaped zone sitting there? That is called the lunula, and it is the visible edge of your nail matrix, the active growth zone where new nail tissue is generated continuously. Almost nobody is taught to pay attention to it, and almost nobody knows what a change in it can mean. Here's what you need to understand about the pattern. In a healthy adult, the thumb and index finger almost always show a clear lunula. The middle finger usually does. The ring finger sometimes does. The little finger often does not. That variation is completely normal. What should get your attention is when lunulas that were previously visible on the thumb and index finger have become faint or disappeared entirely, when they have shrunk noticeably compared to a few years ago, or when their color has shifted. A reddish or pink lunula has appeared in clinical literature as an associated finding in congestive heart failure and certain inflammatory conditions affecting the heart. A bluish lunula can reflect the same oxygen delivery concerns connected to cyanosis. A lunula that has nearly faded into the surrounding nail tissue can indicate anemia, which forces the heart to work significantly harder to deliver adequate oxygen and carries its own important relationship to cardiovascular health. The lunula earns the final position on this list because a change in it is something most people dismiss entirely, and so a meaningful signal sits there quietly through dozens of routine interactions while the underlying condition continues to develop. Your action step. In good natural daylight, look at your thumbs and index fingers. Is the pale crescent clearly visible? Now look at your middle and ring fingers. If the lunulas on your thumb and index finger have become very faint or vanished, if they have changed color, bring it up at your next appointment and ask for a complete blood count and cardiovascular risk panel. Now let me give you one clear framework before we finish. Today, take both hands to a window and spend 2 minutes looking. Check nail bed color for any bluish or purplish tint. Note whether nails had become more brittle or slow growing. Perform the capillary refill assessment on at least 3 fingers on each hand in a warm room. And examine the lunula on each finger for visibility and color. Take a photograph of both hands with today's date and save it. Gradual changes are difficult to remember accurately, and a baseline photograph gives you something real to compare against. If you observed 2 or more of these signs today, do not feel you must wait for an annual physical. Call the office, describe what you noticed, and ask whether you should be seen sooner. And please, do not use any of this to diagnose yourself. These signs exist to make you a more informed and proactive participant in a conversation with your physician, not to replace that conversation. Your fingernails are structures you have looked at every day of your life without ever thinking about what they might be communicating. Now you know how to read them. If this video added something useful, please subscribe so you do not miss what is coming next, and share it with someone you care about. I will see you in the next one.